Welcome to this video on cardiac output. In this lesson, we'll explore its definition, the factors affecting it, and how it's regulated. Understanding cardiac output is essential to grasp how the heart maintains blood flow to meet the body's needs. Cardiac output refers to the volume of blood pumped by each ventricle per minute. It's calculated using the formula cardiac output equals stroke volume multiplied by heart rate. In a resting adult, the normal cardiac output is about 5 liters per minute, showing how efficiently the heart works as a pump. Stroke volume is the amount of blood ejected by each ventricle in one heartbeat, normally around 70 milliliters. It depends upon three main factors. Preload, the amount of blood filling the ventricles before contraction. Contractility, the strength of ventricular contraction. Afterload, the resistance the heart must overcome to eject blood. Heart rate is the number of heartbeats per minute, normally between 60 and 100 in adults. It's controlled by the sinoatrial node, the heart's natural pacemaker, and influenced by the autonomic nervous system as well as hormones and reflexes. This flowchart provides a clear summary of how heart rate and stroke volume combine to determine cardiac output, the total amount of blood the heart pumps per minute. Left side shows factors affecting heart rate. Heart rate is mainly influenced by autonomic innervation. The sympathetic nervous system increases heart rate, while the parasympathetic system decreases it. Hormones like adrenaline and thyroxine can raise heart rate. Fitness levels, for example, athletes often have a lower resting heart rate due to efficient cardiac function. Age is also an important factor, as heart rate generally decreases with age. Together, these determine how frequently the heart beats each minute. The right side shows factors affecting stroke volume. Stroke volume depends on how much blood is pumped per beat, influenced by heart size. For example, larger hearts pump more blood per beat. Fitness levels, that is, improved cardiac muscle function, increases stroke volume. Gender. Males typically have a slightly higher stroke volume due to larger heart size. Contractility. Stronger contractions increase stroke volume. Duration of contraction. Longer filling time enhances stroke volume. Preload or end diastolic volume, the volume of blood in the ventricles before contraction, that is, more filling leads to greater output, which is the frank-starling mechanism. Afterload or resistance. Higher resistance like high blood pressure decreases stroke volume. We know that cardiac output is equals to heart rate into stroke volume. So any change in either heart rate or stroke volume will directly affect the overall cardiac output and therefore the amount of blood supplied to the body. Now, what are the factors affecting cardiac output? When heart rate increases, cardiac output rises, but only up to a certain limit. If the heart beats too fast, the ventricles don't fill properly and output drops. Stroke volume increases with higher preload or contractility but decreases with higher afterload. Cardiac output is finely tuned by intrinsic and extrinsic mechanisms. The intrinsic mechanism, known as the frank-starling law, states that the heart pumps what it receives. The more it fills, the stronger it contracts. Extrinsic control involves the nervous and hormonal systems. Sympathetic stimulation increases heart rate and contractility, while parasympathetic stimulation does the opposite. Hormones like adrenaline and thyroxine also boost cardiac output during stress or activity. Clinical importance. Cardiac output is crucial for maintaining adequate oxygen delivery to tissues. A low cardiac output can cause organ dysfunction as seen in heart failure. High cardiac output may occur in conditions like fever, anemia, or hyperthyroidism. Monitoring cardiac output helps physicians evaluate heart performance and tailor treatments effectively. Thank you for watching. Stay curious and keep your heart healthy. Subscribe for more anatomy and physiology videos.